Hi, I'm Ali Ryan and welcome to all your fertility questions answered with Sims IVF. Today we're going to be chatting to an expert panel answering all your fertility questions from AMH testing to egg freezing. There are also so many common misconceptions when it comes to fertility, so we're going to be busting some serious myths today. Today we're going to be talking to Dr. Moses Batwala from Sims IVF, Thalia Heffernan, and the Director of Nursing and Clinical Services in Sims IVF, Mikey and Holly Carpenter. There's a lot of questions to get through. We asked our readers what questions they had, and there were so many different ones, so we'll try and get through the basic questions for a start. So Mikey, I want to start with you. Let's talk about just the absolute basics. What does it mean to actually be fertile?
So Ali, to be fertile is really to be able to conceive a child or have a baby. But then there's also the other side of that, to be infertile. And for that, I'm going to ask Moses to describe that.
Thanks, Mikey. The clinical definition of infertile is when, and it's some of these terms are kind of have been in use for a very long time, so there are new explanations. But the old definition is of infertility is when a heterosexual couple have been trying to conceive for more than 12 months of having regular intercourse and have failed to become pregnant. That is the old definition. But even the term infertile, it's kind of going out of date. And currently, most doctors in the current day and age prefer to use the terminology subfertile. And it's really to define that people are having a bit of difficulty getting pregnant. We rarely ever find people who are truly infertile, which means cannot become pregnant. And so we'd say what I define as people having difficulty getting pregnant is when you've tried to get pregnant for 12 months, that's if you're in a heterosexual relationship and you're having difficulty, or when you're having regular intercourse. And that's really the definition. And there's so many reasons for this, which is too large to expand on. But that's generally the definition. If you're having 12 months of regular intercourse and you're having difficulty getting pregnant, go and see a doctor.
That's good to know, because I think some people feel if they don't get pregnant straight away when they're trying, there must be a problem, but it can actually take up to a year.
Yeah.
So you could technically be fertile, it just doesn't happen straight away.
That's very true.
Okay, so if it's 12 months and you're in a heterosexual relationship, that's the time to maybe go in and speak to someone. We want to talk about the very first steps today in fertility. So AMH testing. I've got my AMH test, so is Holly today in the panel. What is it? Because I know when I was going in, I didn't know what to expect. Was it a blood test? Was it invasive? But it's actually quite simple, isn't it?
Yeah. AMH, it stands for anti-Müllerian hormone. And it is one of the many tests we have to measure the what I'd want to call it the ovarian reserve. Many people call it the how fertile a woman is, but it's really how ovarian reserve. How many eggs does a woman have? It's a quantitative test, meaning it's just looking at quantity of eggs, not quality.
Yeah, okay? Which is important.
Which is a different thing. You can have a low number of eggs, but they're very good quality. Yeah. So you can have a low AMH, but very good quality eggs. For example, if you're 25, 26 years old and you have a low ovarian reserve, a low AMH, but because of your age, you have very good quality eggs. On the other hand, you could be a woman of advanced age, 48, 49, but you still have good number of eggs, which does happen occasionally. You have a good AMH, you have lots of eggs, but because of your age, the quality of those eggs is not as good as when you are in your 20s.
And that's why egg freezing is important at a younger age, which we'll get into in a little while.
Yes.
Mikey, just from your perspective, when someone comes in for an AMH test, I'm sure there's a lot of nerves. Like, you know, what would you say to people who maybe want to get tested, but they're very nervous about hearing the news? They don't know what to expect.
Yeah, because it's so easy for us to say, oh, it's just a simple blood test. But there's so many people out there that are terrified of even a needle. But what we try to do is hold your hand through the process. So AMH, as Moses said, is anti-Müllerian hormone. It's a hormone that all women have. Normally we would invite you in, we'd do the blood test. The result is normally back within 3 days. And when we give you the result, it's a number. And we compare that number to your age. And there are statistics out there that would say when you're 35, you have half the number of eggs you had when you were 25. And when you're 42, that number has diminished again. So it is really important. And for women, it's really empowering. You know, if I was a woman, I would want to know what my AMH is in my 20s because, you know, we're all so career driven now.
Yeah.
And I think the ability to have babies, you know, and to plan your future is so important. So to be able to marry those things together, it's just really important. And we hear that expression, knowledge is power, and knowing what your AMH is going to be, you know, fruitful to the rest of your life.
And that's definitely what we want to kind of ride home with today, is that it's just knowing. And it is scary because you don't want to get a bad result. Like, I'm 32 and I went in and I was so scared it was going to be bad, but now I'm just so glad I've gone in and I'm starting the journey of freezing my eggs. Whereas if I had buried my head in the sand, who knows where I would have been in a couple of years' time. So it's really, really important. Dr. Moses, obviously I mentioned there, the sooner the better is how I think of this. What age would you, I suppose, suggest for someone to go in? It doesn't mean they have to actually freeze their eggs, but to go in and get tested. What would you suggest?
You're right. The younger you are when you know what your ovarian reserve is, the better. Generally speaking, I would say the best time for a woman to check her AMH, if she's not actively trying to get pregnant, is anywhere between 30 to 37 years old. Okay, and the reason why I suggest this is basically women are born with all the eggs they ever have. Okay.
That scares me so much. Can I just say, when I was told that, I went in, it was the first, I was like, oh my God, they're there literally the second you're born. It's mad.
Actually, they were formed when you were 16 weeks pregnant in your mom's tummy. Wow. That's when your eggs
were. So blame her if there's any problem. Okay.
Yeah, but and literally from when you were 16 weeks pregnant in your mom's tummy, that's when you had the highest number of eggs you'll ever have. And that was about 7 million.
Wow.
By the time you were born, that number has come down to roughly 2 million. Wow. And then by the time women hit puberty, that number has further decreased to about 500,000 eggs. And from that time, when you start having your periods, depending on your genetics, a woman would, although you ovulate and release one egg, actually about anywhere between 100 to 1,000 eggs start that journey with that one egg that eventually gets ovulated, and they perish away and disappear in that cycle. Of course, if you're losing about 1,000 eggs a month, you're going to go through your supply much quicker. Yeah. Whereas if you're losing about 100 a month, you go through that supply much slower. And once you've run out of eggs, that's when you hit the menopause. And the average age of the menopause in Western Europe is about 50 to 53 years old. Now, the women who go through their supply slower, they end up going into the menopause when they're about late 50s, 60s, 60 years old. And those women who are going through their supply much quicker might even go through the menopause by the age of 40. The old term we use for that is premature menopause. That's
and that again is why testing is important, because you might be planning to have a family 39, 40, 41, but if you know that there's a possibility you might go into early menopause, then it's good to...
That's exactly the reason. Okay? But very important to know that even if you go through your supply much quicker, it doesn't change the quality of your eggs. So even if you're a woman who's losing your eggs very rapidly and you're 32 years old, and there's another lady, and so your AMH might be lower, and there's maybe one of your friends and she's going through her supply much slower, and she has a very high AMH and she'll go through the menopause later. If you're both trying to get pregnant at the same time, the quality of your eggs, which is set by your age, is the same.
Okay. Wow.
And the important thing to know, it only takes one egg and one sperm to make a baby. So that just because someone has a higher AMH does not mean they have a higher chance. No, if you're the same age, your chance of getting pregnant, as long as you still have eggs, is exactly the same.
That's really comforting, because I think people get really worried, and especially like since I've started doing the testing, I've been getting my friends tested, and we all have different numbers. I'd be slightly on the lower side, but still I'm fine. But then I'm hearing like a lot of high numbers, and I'm like, God. So to know that that's not really what it's about. It's about the quality of the egg. Now, one of the questions we got asked a lot when we put up our Q&A box was, what is the optimum AMH level? But that depends on a lot of different factors, doesn't it?
Yes, that is correct. It depends on what age you are. Also, we're talking about getting pregnant, and we're kind of like forgetting that it takes two to make a baby. So it also depends on does your partner have a normal sperm count as well?
Yes.
Okay, lots of women put a lot of pressure on themselves,
yeah.
but 40% of the time, when we see couples who are having difficulty, it's actually the issue is with the male partner, not with the female.
So if you're a couple who've been trying for the 12 months, like you said, should they come in with their partner as well? Should both parties be tested from the get-go?
That's what we'd encourage and would say that yes, both should come in, because fertility is not an issue of one; it's an issue for the couple if they're a couple trying to get pregnant.
We always blame ourselves for these things. It's crazy, but it does take two to tango. Mikey, before we go into the process of egg freezing, the options in Sims IVF provide to patients, there's so many different things you can go in and you can get checked and you can get done, but there's a lot of fertility myths surrounding the services, surrounding what we were talking about there, AMH. So I wanted to go through a few myths and I want you to debunk them for us. So firstly, this is the most important thing, I think, because it's the most popular question we got. Does taking the pill in any way affect your fertility?
No, and we would say no, you know. There's so many girls, women out there that have been on the pill from when they've been in their early teens because of having issues with their menstrual cycle or pain with their menstrual cycle. We would say no. You know, obviously when you're going to start trying for a baby, you would stop the pill, and within a few months your cycle should regulate. If it doesn't, that's the time to link in with your doctor, your fertility clinic.
But people are genuinely terrified. I've been on the pill since I was 17, I've been on the pill since I was 20, and they're really concerned that they should maybe stop much younger in order to get pregnant in a couple of years' time, but really it doesn't affect it at all.
No, and again, that's a life choice. You know, where are you in your life? You know, are you ready to stop the pill? Is it going to totally disrupt your life? And really, we're all in pursuit of our own happiness. We have to look after ourselves, so you have to do what's right for you.
So it's a fear that's really unfounded then?
Absolutely.
And if I could add, actually many of our protocols when we're treating women to try and help them become pregnant in the IVF process, we actually sometimes use the pill to help schedule their periods. So people should not be worried about the pill affecting their fertility. We actually use it as well to help us in our treatment in IVF.
And another popular misconception that we came across as well is that people think you need to have sex every single day while you're trying.
Men think that.
Yeah, well, men definitely think that.
Yeah,
but
I know what to do.
you see it in movies and TV shows where, you know, where a couple are trying to get pregnant and it's like, right, the alarm every day, they're having sex all the time. But that's actually not the case. It's not necessary.
You don't necessarily have to do that. Although I have to say, the more you have sex, the more likely you are to get pregnant.
Yeah.
However, sperm can survive in the female genital tract for 3 to 5 days.
Yeah.
And so as long as you're having sex about 3 to 4 times a week, they will always be sperm there whenever the woman ovulates. Okay. So you don't need to have sex every day because, as I said, sperm survives in the genital tract for about 3 to 5 days, and so as long as 2 to 3 times, 4 times a week is appropriate. But the more having it every day, there's no issue with that either.
And another myth, and again I blame Hollywood for this one, that you have to lie down after sex in order to conceive.
Definitely not. I'm not sure where that one came from. I think it's a good excuse.
It's a good excuse to lie down afterwards, but it actually medically doesn't make a difference.
Yeah, it doesn't make a difference because sperm are microscopic, and where they survive, there's the surface that the sperm get ejaculated onto. It's not like a smooth floor it has tiny ridges and stuff where the sperm can actually swim along. So you getting up is not going to make it.
It's not going to change the direction that they're going in.
It's not going to change the direction. It's going to be able to swim across.
Another popular question, I'm interested to know the answer to this myself. Does exercise and diet, can that affect fertility? I mean, is it more likely you're going to get pregnant if you're eating well and you're exercising regularly?
I'd say moderation is the main thing here. Too little. If you have a very sedate lifestyle and you're not doing any exercise, you're more likely to gain weight and you end up with a raised BMI, which can sometimes affect your cycles, your periods. And so you don't want to be doing no exercise at all. A moderate amount of exercise is good, but at the same time, right on the other end of the scale, over-exercising is not a very good thing. It can, especially if you end up having a very low BMI, and that can affect your menstrual cycle as well and your ability to ovulate. We see this especially in elite athletes, you know, like marathon female.
I was just about to say, don't run a marathon every day then if you're trying to get pregnant. So yeah, you see it there as well.
Yeah, we see it in elite athletes and even professional like female football players.
Okay.
Who exercise a lot. It does affect their menstrual cycle.
So balance basically is the key.
Exactly, balance and a healthy diet, of course, is very good. Cutting. Not smoking, cutting down on alcohol, cutting down on the amount of caffeine you're drinking. So there is advice. I'm not a professional nutritionist,
yeah,
but
moderation is basically
moderation
key.
is the key.
Another question we got, which is really interesting as well, is there's a lot of anxiety surrounding the COVID-19 vaccine. So when the vaccine first came about, I'm sure Mikey, you saw this as well, there was a lot of worry, completely unfounded worry that the vaccine was going to make women infertile. Have you come across that in the clinic? Were people worried?
Absolutely, and with the way government guidelines have been moving and they're constantly changing, that was one of the barriers we had within the clinic. And obviously our first port of line is to look after our patients and to give the correct advice.
Yeah.
So really what it came down to was we said to everyone, yeah, you should absolutely go and get the vaccine. The research out there did not say it was going to affect your fertility, the same as if you were pregnant, you should have the vaccine. And really that's what our patients have been doing. You know, it's just with the booster that's come out recently as well, you know, if anyone here has had the vaccine, you probably did have a high temperature after it. That's always not ideal.
Actually, a lot of women talked about their periods changing, which actually happened to me. I got my period early both times I got the vaccine. Now, personally, I wasn't worried. I didn't think the vaccine was going to make me infertile. I just thought my body was reacting to something that was quite big, that was, you know, getting into my system. That's how I saw it. But I saw other women online freaking out. My period changed. Does this mean that I'm becoming infertile? What's happening?
And absolutely, and you can see that women's periods change for a lot of reasons. Long haul flights, stress, arguments. There's many reasons why your cycle can change. The vaccine, obviously, all of us, you know, some of us flew through it, some of us felt horrible after it. So you can imagine if you felt a bit off for a couple of days, it can upset your cycle. But when it comes to fertility, no, there's no evidence.
Yeah, I was just going to say that to you, Dr. Moses. I mean, from a medical perspective.
What has been shown is that when women had the first jab, those who were taking the vaccines that required 2 jabs, it didn't really affect any women's cycles when they had the first jab. What was noticed is that when the women had the second jab, quite a significant number, anywhere between 20 to 30% of women noticed their periods changing. Maybe they were longer or shorter. Sorry, not periods, but their cycles. Sometimes they felt they were heavier, and this may have lasted 2 or 3 menstrual cycles. But then after that, they went back to normal. And again, this was seen again when they had the booster shot. It did. Yes, we noticed these menstrual changes. It didn't affect their ability to become pregnant. It just altered their cycle. We don't know whether it altered their ovulation during that cycle. But what we do know definitely is that after the second or third cycle, everything went back to normal.
And that's what happened to me. It went straight back to normal. So I think there was a lot of people just trying to worry people for no reason, you know. And it was scary because the vaccine was at such an early stage. And I just remember there was a lot of worries about it. And from the Q&A we did, there's still a few people maybe a little bit worried about the vaccine. But as far as you guys are concerned, there's no effect on fertility.
No.
Okay, that's really important. Okay, so we've debunked some good myths there, but we want to get into the process. So Mikey, tell me in the most basic terms, how does egg freezing work and why is it an important thing to do for someone who is planning to have a family in the future?
So the process, so really you've made a decision now, you know, you're feeling empowered, you're like, right, you found your fertility clinic, Sims IVF, that's going to help you through the process. So really you have a couple of consults with your doctor, then you have your investigations like you've had as well. And then really, once you're ready, so we would wait for your period to come. So when you start to bleed, this is when you will start your medications. So in the days before that, you'll have picked up your medications from the pharmacy. One of our nurses will have educated you on how to use them. There are a couple of injections that we will counsel you through, because obviously no one wants to inject themselves.
Yeah, I'm so used to because I'm diabetic, so it's a very easy situation for me. But yeah, it can be very scary.
Absolutely.
The thought of and some people want their partners to do it, but we have to remember that some women do this journey on their own.
Themselves.
Yeah.
And don't tell anyone.
Yeah.
You know, so you know, you start your cycle, you come in for a scan. Another thing that can be quite scary for women is the scans are internal. It's not a scan on your tummy.
I didn't know when I went in.
Yeah.
But it was actually totally fine. And obviously in the scan, we'll chat more in depth about it, but they're looking for the follicles to see how many eggs you might have. And I was so scared. And then I could just see them all on the screen. And it was the most comforting thing, just knowing they were there. So it actually wasn't scary at all.
And that's it. That's what we do. We kind of hold your hand through the process and mind you, you know, because it can go one way or the other sometimes, and it's, you know, it can be life-changing as well. So really what we do is you have 3 or maybe 4 scans along that cycle. When you get to day 12 or sometimes day 14, that's when we go, okay, right, we're ready to collect the eggs now. So we give you a specific injection to take at a specific time. You come in 2 days later and you have your egg collection.
Yeah.
And the egg collection is done under what we'd say conscious sedation. So it's like if you were going into hospital for a day case, it's not full anesthetic. And your eggs are then collected. They go into the lab, they're examined under the microscope. And then the next day when you're home, you get a phone call from the lab to say how many they were able to freeze.
That's amazing.
And those eggs are frozen in time, whether you use them when you're 30 or 40, whenever they don't age, they're frozen.
Yeah,
That's
I was going to talk to you about that, Dr. Moses. Obviously, I'm starting to freeze my eggs now, so I'm going through this. And one of the most important things to me is that if I choose to have children at a later time, the age of my eggs will still be my current age now, which is 32. So what are the first steps in freezing your eggs? So if someone's going in, they're doing the AMH testing, and they realise maybe the numbers aren't as high as they wanted them to be, would you suggest just freeze them if you're thinking of having a family? Or like what's your suggestion, I suppose, for when do you know it's right to actually freeze your eggs?
Oh, okay, yeah.
A loaded question, I know.
Yeah,
I know.
loaded question.
Some people will just know, like I knew, but I definitely think there's some women who maybe are single and they really want to have children at a later date, but they're not really sure if they need to freeze their eggs.
All right, so firstly, maybe it's also another myth. People who freeze their eggs are not infertile or subfertile. Yeah. It doesn't mean you will have difficulty getting pregnant if you met Mr. Right and try to get pregnant with them. In fact, we have statistics that show only 30% of women who freeze their eggs ever require them in the future for treatment. 70% of women who freeze their eggs when they eventually try and get pregnant with a partner, get pregnant naturally. I
thought you were going to say statistically when people get their eggs frozen, they meet Mr. Right.
That's another
I was like, I'm heading off. I'm gone. That's really interesting though. So 30%.
Yeah, only
so it's basically an option B for a lot of people.
It's an insurance policy, and that's the way I normally describe it to women who come for consultation. I describe it like ever since I was in my 20s, I've taken out home insurance, you know, for burglaries and I've never actually required it.
Exactly.
It's an option B. And this is the same thing. Freezing your eggs is like an insurance policy you may need. But we know that vast majority of people never use their home insurance policy. Same thing, vast majority of women never require to use their frozen eggs because they're not, all we've done is just frozen your eggs. We haven't done any tests to show whether you're going to have difficulty conceiving naturally in the future. Okay, so that's the first thing. And then another thing is because again, a lot of our data is based on studies that were done about 15, 20 years ago. And 15, 20 years ago, we looked and saw you had a very good chance of having a baby with your frozen eggs if you had frozen between 10 to 12 eggs.
Yes, yeah.
Okay, you had a very good, I'd say about a 90% possible. If you're under the age of 37 and you froze 10 to 12 eggs. However, this was based on old technology. We used to freeze eggs in something called slow freezing. And the survival rate of eggs was only about 80% with that. Currently, we use something called rapid freezing or vitrification. And here the survival rate of eggs is about 95 to 98%.
So, for example, if someone did an egg collection and they had 10 eggs, the viability of those 10?
It's about 95 to 97% will survive.
Yeah, because a lot of people think, and I actually thought this as well, so you're busting some myths for me, is that when you freeze your eggs, maybe only one of the eggs would successly work.
No. If you, with the old technology, if you froze 10 eggs, maybe 8 would survive when you unfroze them.
Right.
But currently, with the new technology,
it's amazing.
It's almost, if 95, I mean, it's almost 10 out of 10 or 9 out of 10 would survive.
So what age would you suggest starting this journey? Because there might be women in their late 20s that maybe they're very busy with their career or they're single and they know they don't want children yet, but they're getting a bit nervous about the egg quality reducing or the egg quantity reducing. What age would you suggest to investigate this?
Again, one thing which I'd say is that there's the general and then there's the specific. In general, if you were to ask me, when should you investigate your ovarian reserve or think about egg freezing? In general, I'd first say anywhere between 30 to 37 years old. That's in general.
Yeah.
Now, if you're 26 years old, and one thing which is very important is a lot of time, ovarian reserve, it runs along the female line of a family.
Yeah.
Now, if you know that your mom went into the menopause when she was 40,
yes,
or in her late 30s, there is quite a good chance that you may be following the same trajectory.
Okay.
So if you found out if your mom mentioned, oh, by the way, I went into the menopause when I was 39, then if you're in your 20s, it is a very good idea to check your AMH and maybe freeze your eggs when you're younger.
Yeah.
However, if you have regular and also if you're a woman who has very irregular periods, sometimes they're long, sometimes they're short. Sometimes that could be a warning that there's something wrong with your ovarian reserve.
Yeah.
Go and see your doctor. Have things checked when you're younger. However, if your mother says, "Oh yeah, I went into the change when I was in my mid-50s," and you have a regular cycle, I'd say there's no need to panic. Wait until you're between your 30s and 37. If you're not actively trying with your partner, and then have things checked then.
And then another question we got that was quite popular as well, these are obviously women who have gone for the AMH test but maybe haven't gone further, was can you still freeze your eggs if your AMH levels are quite low?
Yes, you can. And again, it's all depend, or it's what is the clinical scenario there. If it's low and you're 25, the quality, or 28, your quality is very good. Almost 70-80% of your eggs are good quality and would result in a child being born. So even if you are collecting 1 or 2 eggs from a 28, 29-year-old lady, there is a very good chance that is enough for her to have a child because of her age.
Yeah.
So
don't let the numbers alarm you too much.
Exactly.
Okay.
Don't it's really important that you speak to your doctor.
Yeah.
They get all the facts together, and then you can make a
As Mikey
decision.
said, knowledge is power. Before we go further into egg freezing, I want to chat to Holly and Thalia now.
I was just going to say one other thing. And egg freezing doesn't mean you only have one shot at it. Because even if, let's say, you have a very low ovarian reserve, it doesn't mean that, if we collect 1 or 2 eggs, for some women who, let's say, they're at an older age and we need more eggs, we can do several egg freezing cycles in a year or over a number of years.
Yeah.
And that will help you then accumulate a good number, a larger number. So there are solutions.
Yeah.
Don't get, I don't want anyone to get disheartened and think, I have a low number, that's me
And
done.
then they just
No.
leave it.
Yeah, we
yeah.
can't. We do have solutions where we can end up collecting over a period of time, so that you can get that bunch of eggs that would give you a good chance of having a child.
We will go into the process more, but I want to chat to Thalia and Holly now. So Holly, you got your AMH test recently, and you got your results. How did you find the experience? Like, were you very nervous about it? How did you feel?
I think the whole concept was very new to me, even though I have just turned 30 last year. So I'm not 31 yet though, so I'm still 30. But I was obviously more conscious about my overall health and all of that as you get older. But so I was a bit nervous going into it, not so much for the results in a way. I'm not great with needles. So I even being in that environment, I get really, everyone's different with that. So the nurse was lovely. She was like, if you don't want to look, I won't even tell you and I'm going to do it. And I was there and it was over before I even had panicked.
And had you thought about your fertility before this point, genuinely? Had it been something on your mind?
I find it bizarre that we don't learn more about this in school, because I think if I had learned as much in school as I had in the last 5 minutes, I probably wouldn't have worried as much.
And you know what I always think is so funny? When you're in school, it's like, don't have sex, you're going to get pregnant. And then when you're older, it's like, it's actually quite complicated to get pregnant.
I know.
So we grow up, especially in Catholic Ireland, in a very different understanding of what sex is, what menstruation is. Like you said, the last 5 minutes, we probably all learned so much more. So
exactly.
For you, has this been a bit of an eye-opener then?
Definitely. I mean, I remember we all thought there was a girl who got pregnant from going down a water slide.
Yeah.
That a sperm just jumped into her top.
Holly's busting some myths as well here.
It's actually crazy.
And that fear stays inside for a long time.
I think so I was nervous, but actually just looking it up, being on the website, it gave me that sense of clarity. And even no matter what my results had been, knowing that I had kind of just done something for myself and taken the power in my own hands and just gone, look, whatever the results may be, I'm here to just find out. And also they've seen every result in the book in the clinic. So no matter what you come out with, you know that you're in good hands. Yeah. So I didn't feel too panicked in that sense. But
and actually, as Dr. Moses has said, even if the result maybe wouldn't have been what you wanted, there's ways and means to have a family.
Exactly, yeah.
And obviously, so you're 30 now, you're in a long-term relationship. One of the things I wanted to talk about today, I suppose, is the pressure that's on women to have children. And this is why I think egg freezing is very important, because we mightn't want to have kids till we're 40. It's totally up to us. But do you feel there's societal pressure around that?
I do think that it's a really Irish thing that people think you can just ask someone, day 2 of their wedding. So when are you going to have kids? Yeah. It's like, I know, it's a calm
and
down.
for all they know, that person might actually have fertility
exactly.
problems.
And I think as well with social media, you get to a certain age, people are waiting for the engagement announcement, the wedding, then the baby, then whatever. So it can feel like a lot of pressure, but hopefully I feel like there has been a bit of a shift with more awareness around the fact that it's not that easy all the time. Yeah. I think more people have shared their IVF journey. They've shared that they're struggling with fertility. They've shared that they might be adopting. So through social media, I think people have kind of learned that you can't just ask the question, because there's so many different ways it could be going for someone. Yeah. But aside from all that, I do still feel like it was more when I turned 30 that suddenly I'm going to a christening later and I'm like, oh my
God,
babies everywhere.
Babies. Yeah. So do you think that 30 is a good kind of age then to start investing in this as well?
I think so. I mean, I think it's probably, everyone's going to be completely different. For me, it felt like the right age, and I'm really glad I did it.
Yeah. Thalia, same question to you, I suppose. You're also in a long-term relationship. Is this a question that gets asked? Do you feel pressure surrounding it?
I think I do. Probably in a different vein to Holly. Because of my job, people don't ask because they assume as a model I can't get pregnant because I'd lose the shape of the body and it would just throw my career out of whack, which
is a whole other level of pressure.
Yeah, which is a whole other level of pressure, and we've seen how many models come back from that. But anyway, that's a different conversation. I definitely do still feel it though. I've been in a 5-year relationship, but I've had concerns about fertility for a very long time. So it was very interesting when you mentioned, Dr. Moses, about the lineage and the kind of bloodline between mother and daughter. So my mum was deemed infertile, and she had to undergo surgery. She had 2 kids, and then 9 years later, she fell pregnant with me at 42. So she would have been
a miracle baby.
I'm a miracle baby. Yeah. My name is Thalia Angel. I'm a miracle baby. There's all of these terms thrown around. Yeah. So they're the nicer end of the terms. But then you've got geriatric pregnancy, and she then fell into her menopause afterwards. And I remember speaking about my conception and the whole process, and it was just quite a negative. The terminology, the medical terminology, and then obviously my mum's own experience was just quite negative and scary. And so I've always had a fear of my own fertility and what my journey might look like. And my sister thankfully had no issues when she had children. But before the lockdown, I had booked in, so I was 24, to get a fertility test because it was something I was concerned about. And then the pandemic hit and I didn't follow through with that. So I just feel really comforted in this panel and talking about these things and knowing that even if there is an issue with my family line, I mightn't necessarily face those issues, and there's also options for me. And like you said, there's specialized treatments for people, and you don't have to necessarily just assume you're infertile or you're barren or all these words. And the fact that you even brought up, Moses, about the infertility not being used anymore. I just think infertility is such a negative term. It conjures up such just confusing emotions, I think, for women and for men.
And your mum had been given that term, which doesn't even exist now.
Exactly. And it's, I think, even to be able to tell her after this, you know, that they don't use that anymore.
So
and
comforting.
even women in her position don't have to go through what she went through, which I think is really important. And I think you mentioned like the Catholic Church response that we all have as women and men in Ireland of, you know, oh, the christening, you know, oh, there's baby talk around your boyfriend, your friends. And I love that we can take it into our own hands, and women can take it into their own hands, and gay couples can take it into their own hands. And it's just I feel very comforted on this panel. And when I'm sitting on this panel, not as someone who's hoping to necessarily freeze my eggs just yet. Now that I know that the options are quite simple and there's loads of ways to do it, I will definitely consider it. But I opened up the question box on my own Instagram because I wanted to come on and learn, which was my main goal, and to also ask the questions that women similar to me would have. And I just feel like they've all been answered, most of them. I hope they have anyway.
That's amazing.
Yeah, I just feel really comforted, and I hope people watching and listening feel the same. It is a really nice thing to be a part of, and I just feel like it's definitely a softer, nicer thing than we assume it to be, because it's so taboo to talk about infertility these days.
And I definitely think it's important to say that, you know, a lot of women feel like they have to wait for Mr. Right, that, you know, their chance to have children is when they meet the right guy, but it's important that there's so many other options, and that's, I'm going to talk to the guys about this now as well. But to Holly and Thalia, is that something you've ever, I suppose, considered before, maybe alternative options to having a family if you weren't in a relationship at the time that you wanted to have children?
Well, I've always thought that I've kind of, to be honest, been laid back about it in my mind. I never really put any pressure on myself, but I've known people who have felt that by, you know, 25 they wanted to meet him, 27 they wanted the ring, 28 they wanted the wedding. And if they don't reach, if they're 28 and they haven't met him, it's like this map that they'd created is all going backwards. And, you know, hyperventilating coming up to their 30th if they're still single. And it's like, I just think that's the worst thing you can do for yourself. So I think, like, for me, I don't know, I've kind of always known in a sense that, you know, you see it in movies, you hear about it, but maybe that's easy for me to say because I was never had this urge to be overly maternal, and I didn't have my baby names picked, and I didn't know how many kids I wanted. But I do feel for women who go, I want 3 kids, I want them by this age. So I think that when you put that pressure on yourself, it probably is harder to imagine going alone. But because I've never really put that amount of pressure, I think I've always known that in a sense the option is there. But also I've kind of found a strange reaction from people too when I've said that I wasn't sure if I was going to have kids. Do you know what I mean? It's like, what do you mean you don't know if you want kids? In Ireland, like it's like you're going to have the wedding and the baby. What are you talking about? So when you kind of give that, I don't know, it's a bit like people were a bit freaked out by that.
Which makes it almost worse for women who maybe want to go down the alternative route, because if you're getting the pressure of why haven't you met the guy, why aren't you having the baby, what reaction are you going to get if you're like, I'm actually going to do it on my own?
I can't imagine. I'd say it's very, and it probably puts a lot of awkwardness and tension on friendships, family relationships, because I can imagine for generations, like if you were to say it to your granny or someone, they wouldn't understand. They would not understand.
I remember the term, just talking about old terms, test tube baby. I heard that one
and there was a bit of shame around it.
And there was a lot of shame, uncertainty. I mean, it's all changed now, which is amazing. So I want to go back to Mikey and Dr. Moses about this as well. If someone is single and they're going to get their eggs frozen, what are the options if they don't meet Mr. Right? If that's just isn't what happens to them, they freeze their eggs, they come back 5 years later and they're like, look guys, I haven't met someone, but I really want to have kids. What's the next step there?
Well, there's so many options really. And I've seen this change over the years. We used to look after women that would be in that situation, and different phrases have been coined over the years. It used to be reproductive choice, which I loved. Now the phrase solo female has come true, or else there's another one out there on social media, single mums by choice, which is brilliant as well.
There's definitely a hashtag in front of that one. I love that.
So I love it too. I love looking after these women as well because they're so empowered, they're so strong. 9 times out of 10, they have really good support around them. And they've made that decision. They want to be a mum and they're going to go it alone, well, with their support of their friends and family. But really, so you have your eggs frozen, maybe 10 years before you come back, you're 35, 36, 37. Depending on your most up-to-date investigations, you could start with IUI, which is where you would decide on what donor sperm you want to use.
Yes.
Which, you know, we've partnered with a company called Cryos, which is really, we give you access to a website, and like that, you look at a catalogue of sperm.
That's amazing.
You look, it's like, you know.
Go through Argos.
Well, you just took the words right out of my mouth, because earlier on I was like, it's like the Argos catalogue of sperm. And like I've looked after so many women where they have donor sperm selection parties with their pals. So like you guys, you know, open.
I was never on Tinder. Maybe this will be my only
And
my chance.
this is what I love about Sims IVF in general, is that you celebrate these things. Because like Thalia, you were saying earlier on about christenings, weddings, it's very hard to think, how can I celebrate this? But I love the idea that there's a party, like everyone's going through the catalogue, picking the guy.
And
That's
it
amazing.
is, and it's like that fertility journey, and fertility journeys can be short or they can be long, you know, but they're individualized, and that's the most important thing. So like our solo females that come through now, they, you know, they just select their donor sperm. You know, we send the order off. Our donor sperm comes from Denmark. And once that arrives, treatment starts. You know, and because you've frozen your eggs already, it's just a case of the eggs are thawed, they're combined with the sperm, the embryos are made, and, you know, then you have your treatment. The same as our solo females that come through that haven't had their eggs frozen, they can still have treatment with donor sperm, and there's different options, whether it be IUI, where we inject the sperm in at a time in your cycle, or whether you can have IVF with donor sperm.
That's amazing. And Dr. Moses, I suppose, percentage-wise, what is the numbers when it comes to, I suppose, how many times does it work? Like, do you have to implant your eggs a few times? What's the realities there? So if someone comes back 10 years later, should they be expecting it's all going to be fine straight away? Can it be a process?
It really, again, it's a context. What age are you? Okay. Now, if you're using frozen eggs and you froze them when you were in your early 30s, success rate is very high.
Amazing.
I'd say it's if you're going to have one embryo transferred from eggs that were frozen when you're under the age of 35, odds are you're going to become pregnant on the first go.
Amazing.
I'd say it's about 55 to 60% if you're under 35. Now, if you're between 35 and 37, it's still about 45%.
As in the age of the eggs? Or the age of the woman?
Age of the eggs, sorry. Thanks for if you froze your eggs between the ages of 35 to 37, it's about 45% chance.
Still quite high.
Between 38 to 40, it's about 30%.
Okay. And what happens if you freeze your eggs at 32, you come back at 42, and there's issues in terms of your own ovaries, and you actually maybe wouldn't be able to carry a pregnancy? Are there options to use the eggs for surrogacy? Because I know this is a kind of weird topic in Ireland where we're kind of unsure about that.
Okay. So firstly, rarely would it be, if there's a problem with your ovaries, your uterus would still be fine to carry the pregnancy. If you've frozen your eggs in your 30s, you're going to have a very high, early 30s, you're going to have a very high chance of getting pregnant, even if you're even 45 years old, even older. There wouldn't be an issue. Now, you've spoken about surrogacy, and that's really when there's a I'd say when there's a medically speaking, because when it comes to Ireland and the UK, where I originally used to work, surrogacy is only there for medical reasons. For example, if let's say you had a hysterectomy because
which could happen in the space of 10 years. That's why I'm interested
which could
to
happen.
see what would happen.
Or if you have other medical reasons which mean that it's too dangerous for you to carry a pregnancy. Some women have developed heart conditions, which means should they become pregnant, that heart condition could get worse. Others have aneurysms in their, which have been picked up in their brains, which is a swollen blood vessel, which again may make carrying a pregnancy dangerous. So for those reasons, surrogacy could be indicated, whereby we create an embryo and it's transferred into another lady who's able to carry that pregnancy for you. Now, as you've already mentioned, surrogacy is still controversial in Ireland. There is no law that governs the practice of surrogacy, and because there's no law, we are a licensed clinic. We can only carry out
what you're legally able to do,
which are licensed by the organization called the HPRA, which is a government body that tells us what we can and can't do.
And Dr. Moses, obviously we've touched on the egg freezing process now, but let's get into the nitty gritty a little bit. Mikey mentioned earlier that you have to take injections. Can you talk me through what the actual process is like?
Okay. So for egg freezing, again, I'll say what is in general. Sometimes it's different depending on clinical scenario, but the most common what we call protocol that women follow when they're having egg freezing is something we call the short protocol. Okay, and typically what happens is initially a woman may be given the contraceptive pill to take from the start of her period for anything between 10 to 14 days. When she stops taking the pill, about 3 to 4 days later, she has another artificial period, and we scan her, and we're scanning her to make sure that everything is quiet with her ovaries. There are no cysts, the lining of her womb is thin, there are no polyps or anything that's going to hamper our treatment. And then once that's checked and everything is okay, she can then start taking her injections. And typically she takes 1 injection a day in the evening over a period of about 10 to 12 days. So it's just 1 injection in the evening. And the injection that they use is very similar to the insulin injection that diabetics use.
That I take, yeah.
And most women are able to inject themselves either in their tummy or on the side of their thigh. And we scan them at intervals of when she first has that artificial period, then 6 days later, and then from 6 days, it's every 2 days. So day 6, day 8, day 10. And what we're scanning is we're seeing how the follicles are growing. Because normally with a woman's cycle, she releases 1 egg. But what we're trying to do with these injections is to get more than 1 egg to grow. We want to get...
kind of boost your follicles, basically.
Yeah, exactly.
Okay.
And we want to get something like anything between 8 to 16 eggs to grow in that 1 cycle. And we scan you throughout over those 10 to 12 days. And when the follicles reach the ideal size, we then give you a trigger injection. And when you have that trigger injection, that's when you stop taking the medication. And then we bring you back 2 days later, take you to theatre. And as Mikey said earlier, it's sedation.
Yeah.
I like to describe sedation. It's a bit like I've had too many Proseccos to drink.
Okay. It often happens. So you're just relaxed a little bit more than usual,
Yeah,
basically.
you're breathing on your own. We're monitoring you. We take you into theatre. The monitoring scans are internal scans, as we mentioned before. And when you're in theatre, we again do an internal scan, and we pass a needle into each ovary. And that needle is connected to a suction, and it's able to aspirate all the eggs that have grown in the follicles. And we're able to check actually that very same day. We hand over all the fluid we collect from each follicle to the embryologists, and they're able to count the number of eggs that are there.
Yeah.
So in most cases, and the actual procedure in theatre lasts anywhere between 15 to 20 minutes.
Okay.
And you come around quite quickly. We give you a cup of tea afterwards. And
a Prosecco?
No Prosecco. And maybe within an hour, the embryologist is able to tell you how many eggs they've collected, and even maybe within 2 hours, how many they're going to be capable of freezing.
Yeah.
So odds are sometimes before you even leave the clinic, you know how many eggs have been frozen.
And talk me through the actual injections, because I think people are worried about how it's going to affect them. And I know it affects everybody quite differently, but should someone expect mood swings, feeling sick? Is this something that can happen?
Okay. Now, what I'd say is that, again, historically, what I've just described is something, a new type of stimulation. It's called the short protocol, or in scientific term, we call it the antagonist protocol.
Okay.
Traditionally, we used to have what was called the long protocol. We still use it in certain circumstances, especially in women who have either endometriosis or women who have fibroids. But it's very much the minority protocol now. It used to be the dominant one, but it's very much the minority now. It may be used in maybe 5 to 10% of cases. And in that protocol, very different. On day 21 of a woman's cycle, if she has a typical 28-day cycle, she's given an injection that puts her into a temporary menopause.
Oh, wow.
And with that injection, about 40 to 50% of women have all the menopausal symptoms, the hot sweats, the mood swings.
This is the process I would have heard of before I actually came to Sims.
Yes.
I thought that's what the process would be.
Yeah, but as I said, that is very much the old tradition. We call it the old conventional protocol, which is going out of vogue, especially because of the side effects that women observe. It is still used, as I said, in a minority because it has an advantage. It helps shrink fibroids. If a woman has large fibroids, which may prevent us being able to access the ovaries and the follicles, or if she has endometriosis, which can have inflammatory and a negative effect on the quality of the eggs we collect, we do use that protocol. But as I said, that's very much a minority protocol as compared to the short protocol, in which most women, especially if we're using low doses to stimulate, they hardly get any symptoms whatsoever.
That's great, because I know some women might be like, I want to do it, but I've this on this month, or I'm working on that, and they're scared that it's going to affect them mentally, like when they feel sick.
What I'd say is, with the short protocol especially, we have lots of women who actually are doing their everyday job. Lots of teachers, lawyers, women who are actually work, and we actually try and fit their treatment around their work schedule, and they're able to continue through work.
Perfectly fine.
The only time when they actually have to take any time off is that the day of the egg collection and maybe the day after to just recover.
Another myth debunked. It's so hard because I think we all get such misinformation, or we rely on movies, and it's so dramatic in films, you know. Mikey, one of my favourite packages that Sims offer is an amazing package for same-sex couples. Tell us about that.
Yeah, so for same-sex couples, so lesbian couples coming through, we have what's called a shared motherhood package, which is where female A would have her eggs collected and female B would then have the embryo that is created from those eggs implanted back to her. So both parts of the couple will have a link, say, to the baby that's
and they
created.
both get to experience the pregnancy basically together.
Exactly, they share it, and you know the technical term is reciprocal IVF. But we had coined the phrase shared motherhood, and I think it's really appropriate.
Yeah, that's amazing. And have you both, I suppose, seen an increase during the pandemic? Because I feel like a lot of people stopped what they were doing in their very busy schedules. Have you seen women maybe come in and be like, right, I actually think I need to look at this. I hadn't thought about it before.
For sure. Definitely from the start of the pandemic, all of our clinics, they exploded.
So busy.
A big part of that was people couldn't travel. So in years gone by, people maybe went to America or Eastern Europe, but really it gave people time to think. People couldn't spend their money on holidays, et cetera, or maybe relationships broke down in the pandemic. So really, you know, I've met some women that have come through that were with a partner for 10 years and then they were at home together for a year working from home, and their relationship broke down. And now that female is in with us having her eggs frozen.
What a 2 years it's been for everybody, my God.
It's really interesting, isn't it? Because we think of the pandemic boom of babies. And I'm really interested, and a couple of people asked me, I hope you don't mind, Ali. A lot of people fell pregnant. Do you think that was stress related, that stress was removed from their lives to a certain degree and they were at home, maybe there was more sex being had, there was more time? I wonder, do you think that was a thing? So a lot of people asked me about endometriosis, which was really interesting that you've already brought it up, Dr. Moses, but pregnancy and stress, and even when you said about the egg retrieval and the egg freezing, how 70% of the time people then fall pregnant naturally. I wonder, is there a stress related to maybe what I had of this fear of infertility? And when you're kind of given that calming advice from the experts and they tell you that there's other options, do you find people then often get pregnant naturally, like you said earlier, because there's kind of that fear removal and that association of, God forbid, you're infertile removed?
Well, I think in the pandemic it made us all stop and think and reevaluate what we're at, what makes us happy. And I think we're all happiest when we're at home. So the pandemic forced us to be at home with our loved ones. So, you know, the happy hormone is oxytocin. So mix in the love of your life and you're at home with no pressures, external pressures. Of course, pregnancies can happen. So yeah, I do think there was an impact there, and my colleagues in maternity hospitals in Dublin will say, yeah, wilder than ever. But I really think the important thing was, I think we just all stopped, had a look at what we were doing, what's affecting us, what are all our triggers.
That's a really important question Thalia just brought up there. Do you think that stress can actually affect the level of fertility in women?
For sure. I think it's hilarious. You know, I say to heterosexual couples or same-sex couples coming through, it's really important you don't get stressed. Like, take time off work. And they're like, are you joking me? Like, I have to take these injections. You're putting that probe inside me. You know, the pressure, am I going to get 5 eggs, 10 eggs, 3 embryos? Like, how can I not be stressed? So that's where all the alternative kind of complement therapies come in. Acupuncture, reflexology, laughing, sharing your worries. We have counsellors with Sims IVF that are absolutely beautiful, that really, and then our nurses and our doctors. Like, I hope you can see, we're nice people, you know, and we will mind you.
Sharing very.
That's it, and it is. You know, like I've got a husband and I've got a 1-year-old and 3-year-old, and that's against the odds, but it's only through the world of fertility and fertility medicine.
And I think that's the biggest thing about today is understanding your choices are not limited. There's actually so many options, whether you're single or you're in a same-sex relationship, things that maybe before were barriers, they're really not anymore. So we're on to the last question, guys. So Thalia and Holly first, what have you learned today? What's your biggest takeaway, I suppose?
Everything. I've learned that what we were taught is not what is real life. I've learned that science has come a hugely long way since my mum got pregnant with me, and I definitely didn't necessarily need to feel the fear I had. But I'm also glad I felt that, because I've come in probably a bit more skeptical than I've left. So I think just the fact that I've met both of you, I would be much more comfortable coming into a clinic, telling you my story, my fears, and knowing the process isn't as scary as necessarily my mum had to go through when she had the same issues. So yeah, I just hope that anyone watching this knows this is a safe environment and a safe space, and you're changing the narrative, which I think is really important for people to realize, that you don't have to be a woman, like Holly said, fearing her 30s without a couple, you know, without a relationship or a home or the infrastructure in place to have a family. And there are alternative methods and there are specialized treatments for people. I'm very comforted by this, and I hope that that's translated in the piece.
I suppose, well, everything Thalia said and put it so well. And also just that I have done the AMH now and I've received my results. I actually didn't realize that I was carrying a bit of a worry. And so the relief I felt when I saw my results and I heard more about my options, I actually sometimes don't think you realize that maybe you are worrying about something, or you're brushing it off. And I'm a real, like, you know, don't think about it. Under the rug, I'll deal with that.
The rug's up to here.
Yeah, the rug's like, okay. So actually just to feel that sense of relief and to hear all these other stories of success and to hear how many, you know, lives have been changed through the different kind of options. So it is really kind of uplifting and really hopeful conversation.
And I definitely think we can all agree there's so many terms that can be thrown out the window, like old school terms. Mikey, then for you, I suppose, what advice would you give to anybody watching who's maybe about to start this journey and is very nervous, even about coming in for the very first consultation?
I'd say don't be afraid. We're going to mind you. We're going to hold your hand. And we're going to educate you. And to get back to my phrase is always, knowledge is power. And we love our jobs in Sims IVF. And, you know, we love empowering women, empowering men, empowering couples, and creating babies and creating families. So we will do everything we can to get you where you want to be. And like, I'm one of those people, I need to have a plan B and I need to have a plan C. And that's what we'll do. We will do it. We are the experts. We'll mind you, and like that, these things, these forums are so important, because talking, it's so important. And go for it, you know.
Same question to you, Dr. Moses. If anyone's watching and they're a little bit nervous, what advice would you have?
I can't agree anymore with Mikey. It's, don't be nervous, come in. There's always an option. There is always an option, and that's what many people think. They'll get some bad news and it will mean that, and they feel like their world is going to come crashing down. But actually whenever patients come in, they actually walk out empowered because they get information. Even if there is bad news, they are solutions available.
Yeah.
And so do come in. Don't just take that first step of coming through the front door. There's a large team of doctors, nurses, embryologists, and we're there for you. We're there to make sure we provide you the options which will be ideal for your particular situation.
Well, thank you so much to Dr. Moses, Thalia, Mikey and Holly. All the treatments and all the testing we discussed today is all available in Sims IVF. You can take a look yourself on sims.ie, where you can schedule an appointment with a fertility specialist. And just remember that Sims IVF have clinics nationwide, and they've helped thousands of people become parents since it was first established in 1997. And I'm sure you can tell after watching today that your hand will be held. It's a very calming experience. If you're nervous, there are options. So as Mikey said earlier, I'm with him on this. Knowledge is power. Thanks so much for watching.